So the first section, we're going to go over an overview of Western medicine menopausal transition, and specifically talk about hot flashes from the menopausal transition. All right, so we all know that the hypothalamus pituitary ovarian axis is what regulates the women's menstrual cycle, and is that keeps the normal cycle going from you know, menarche all the way to menopause, right? So you know, with ovarian aging, that starts throwing off the hypothalamic pituitary ovarian axis as we get older, or as women get older. So what happens? Well, I got a little stretched out, but so here's an example. So trying to look for that arrow. I don't have the arrow. I'll figure that out later. But so the ovary, you know, we could think of as at the bottom of the lower jowl, right? And producing estrogen. Excellent, thank you. And so, you know, the estrogen goes up to basically the top of the body to the brain and triggers the hypothalamus and the pituitary. If you've studied gynecology, if you've studied fertility and reproductive medicine, this is very straightforward. And so I like to always think about this in Chinese medicine. You know, the ovary, you know, estrogen, thinking this is yin in blood. This is our, you know, our essence, our jing. But then as it goes up to the top of the brain, we're talking more about yang qi versus yin qi. We're talking about qi and all the movement of the body. So it's a balance of yin and yang. I'll get rid of this for a second. So what happens over time as women age, as the ovarian, the ovaries, that when they produce less eggs, the estrogen begins to decline because there's less eggs, there's less estrogen being made, right? So if the hypothalamus and pituitary are getting less estrogen, then what happens? Then they start producing more. So if we read this, then the you know, the estrogen is not, you know, giving, or there's not enough estrogen going to the hypothalamus and pituitary, and then they overact. So if we're thinking about our classic idea of yin deficiency or essence deficiency, so we're getting, as women mature, there's less yin, and then you have an overaction of yang. Well, this is you know, partly true, and we'll show a lot of examples in the rest of the lecture. So just to go down the list, and ovulation becomes more common. The ovarian follicle depletion reduces the quality and capability. Estrogen inhibin and progesterone levels decrease, and the negative feedback loop is open. So I think we all know this. And so what are the results? The main thing we're talking about today, vasomotor symptoms, which means hot flashes, night sweats, insomnia, that kind of stuff. So the hot flashes and night sweats are one of the main complaints that your patients will come into the clinic asking you about. Can you treat this, right? The pathophysiology of the hot flash is not necessarily clear. We're going to talk about hypothalamus, estrogens, neurotransmitters playing a role in this. So I don't want to spoil all the details, right? So skin temperature gets increases, heart rate increases, blood pressure increases, that type of stuff. Sleep and cognitive dysfunction happens. So another big factor in the clinic, if you're treat enough patients, you'll see that a lot of people are having difficulty sleeping, right? difficulty falling asleep, staying asleep, or maintaining sleep, and you're like, God, what is it? Is it deficiencies? Is it excess? Is it blood, yin? You basically chase your tail around, right? So we're gonna come up with and discuss the ways of diagnosing this effectively. And along with sleep, hot flashes, etc., memory generally declines with age, but not usually during the reproductive years. And this is something that's interesting too. It's there's more temporary memory loss of short-term memory, which we attribute to in Chinese medicine as this, like the spleen and stomach, which happens during perimenopause, but it usually regulates out after in postmenopause for most women. Psychosocial changes, mood changes, concentration, impaired memory, depression. You'll see this in clinic. Contributing factors. We'll talk about lifestyle, how that really affects the overall severity of hot flashes. Worry, finances, social status, lifestyle, education. I have a patient right now I've been treating for years, and she has the trifecta of all that. She just has all these issues, and it's really difficult to keep the hot flashes at bay because of this consistent pressure on her and her life. Cardiovascular changes. You probably know about this, so it's natural that cardiovascular issues, diseases do increase with age. So always keep that in the back of your mind, but that's common to start increasing. And that's pretty common with men too, 40s, 50s, stuff like that too. So that's pretty normal. Weight gain and fat distribution is a common clinical complaint as well, right? It's like, why am I gaining weight? I can't lose weight. And it's usually due to slower metabolism, but also less activity. As we get older, we get tired, we're less active. And the metabolism does slow down a little bit more. If you treat enough patients, you see that it's a little more leaning against women than men in that style. But one thing I'd like to point out, there's a wonderful article in the Menopause Journal that talks about how the weight gain is not necessarily attributed to the estrogen deficiency, but it is more, points more towards lack of activity and a slower metabolism. So we also have to worry about the increased fat distribution around the waist and abdomen, which in general is, in Chinese medicine, we have heat and stagnation and that type of dampness. And so we have to worry about things like that too. Lower reproductive tract changes. Declining estrogen will cause issues in the, reproductive area, vulval, vagina, things like that, urethra. There will be UTIs, painful intercourse, things like that. So yes, there is a big factor of estrogen playing a role in this. So, we'll talk more about, some of the treatments for these local problems. Topical estrogen is very common in the Western clinic nowadays. In Chinese medicine, we look at yin deficiency, maybe a little damp heat, but I think of it mostly as a qi and blood flow. So, tonify yin and mildly promote blood flow is a good way to treat that. Libido changes. It's difficult sometimes for women to talk about this in the clinic. So sometimes you may not get the full answers from certain women. Some women are very open to talk about this. Being a male practitioner, it gives me another little bit of disadvantage. Maybe some women won't trust talking to a man. But anyway, so there are libido changes, and that's discussed here. And it's, is it a direct link to the hormones? Maybe. Is it due to painful intercourse? Studies suggested decrease in sexual thought, satisfaction, lubrication, or desire. So, a lot of factors involved in that. And many women have have these changes.